Hello, how are you?
I'm good, thanks. Thank you so much for having me today.
Well, thank you so much for coming here. Firstly, do you want to talk about yourself? Who are you to our viewers?
So, my name is Jane, and I'm currently a medical student in the UK.
Wonderful. Well, firstly, we're here to talk about social prescribing, students for social prescribing. To you, what is social prescribing?
So, coming from Australia, social prescribing was a very new term for me, and it's something that I've learned from being in the UK. And I think it's an amazing program, and people think it's something to do with social work, but it's about holistic care of the patient and realizing that there really is a person behind the kind of disease, and that to manage a patient properly, you need to make sure that they're feeling well at all different levels. And so for some people, that's making sure that they're connected with friends, family, social groups, and wellness programs at a grassroots level.
Amazing. What a fabulous center. Thank you so much.
Next, how do you think you got involved in social prescribing in your medical practice?
So, in my medical practice, I guess as a medical student, I see patients that are in the hospital burdened by disease and very focused on, I guess, the disease process and how they're feeling. But I think encouraging people to connect with other people that are going to help them in the community, whether it's social programs or sports, gives them a life outside of their disease and makes them, feel maybe mentally more well and better.
Amazing, yeah. And so you as a doctor, the future doctor, how would you approach the fact of knowing if a social prescription is actually helping the patient or not?
So I think it comes down to what we call motivational interviewing. So find out what is important to the patient and find out how we can make their lives better, and relating it back to their own wellness journey.
Amazing. Finally, what's one moment or story that made you realize social prescribing truly works?
So I remember when I was at GP practice and I just met someone that it was heartbreaking, telling me about how lonely they were, and how they found a particular autism support group and people that communicated like themselves, and that they were able to go weekly and make friends with people that they felt like they related to, and how that really impacted their mental health, and it made them return to work. And so, financially, they were then earning more money, and they were able to support their life. And then again, their mental health improved. So it kind of creates this stepwise approach of improvement from the base level up.
Yeah, amazing. Well, thank you so much for your time. I think it truly encapsulates what social prescribing is about and our goal as us for students for social prescribing. Thank you so much for your time. Have a lovely day.
Thank you so much.